Welcome to On the Beat. Today I'm joined by our guests from Columbus and Starkville Gastroenterology Associates, Dr. Ricky Johnston and Dr. Richard Hurd. Thank you so much for being here. Today we are talking about H. pylori. So tell us about what that means if we are diagnosed with H. pylori.
H. pylori is a bacteria. Helicobacter pylori is the long name for it, but H. pylori is much easier to say, obviously. But it's a bacteria that grows in the stomach lining in a lot of people, and it can cause a variety of symptoms. And so some people will get diagnosed with it if they go to their primary care provider and have certain testing done.
And should we be concerned if we're diagnosed with it?
Well, it needs to be treated for sure.
Okay.
So probably, you went in with some symptoms. You told, your doctor you were having heartburn or stomach pain, and they tested you for this. But yes, if you get it, it needs to be treated.
Those are the primary symptoms somebody would experience?
Yeah, abdominal pain, bloating, nausea. It can cause a variety of symptoms. It's actually the most common cause of ulcers too, like stomach ulcers. And so oftentimes this will kind of get labeled as the ulcer bug, and people will get diagnosed with H. pylori and in fact be told they have an ulcer, which sometimes is true, sometimes not. The only way to diagnose an ulcer is actually to have an endoscopy or a scope where we run the light down and take a look. But so people can present with a variety of symptoms related to ulcers that could be a manifestation of H. pylori as well.
And then is there a way to avoid?
Well, no, not really. It's kind of this, I think it's one of
it.
the most common chronic infections
Yeah.
in the world. Don't quote me on that. But yeah, a lot of people have it, and there's some theory that even that you pick it up as a child, and many people have it for years and years and years. But the reason it's important to get rid of is there is a risk factor of gastric cancer with that. So there's even one type of lymphoma, malt lymphoma, that's exclusively caused by H. pylori. Well, if you treat the H. pylori, it can get rid of the malt lymphoma. But yes, it's important to diagnose.
This bacteria is unique in that most bacteria are killed by the stomach acid. So it's very difficult for a bacteria to live in the acidic environment of the stomach. For whatever reason, the way that this bacteria is put together, it thrives in that high acid environment of the stomach, whereas most bacteria would be killed off.
And so for testing it, you've got the symptoms, make an appointment with you, and then what is the procedure from there? You go by the symptoms and then choose the...
a lot of people will come to us already diagnosed with it, so primary care providers can diagnose it as well. And there's a few ways to diagnose it. Most commonly in the past, it's been a simple blood test that was testing for an antibody against the bacteria, or that your body makes to fight off the bacteria. The problem with that is that doesn't really tell you about the status of the infection right now, because antibodies can be present during an acute infection or after the bug has already been cleared. So it means you either have it now or you could have had it at some point in the past. So the blood test has fallen out of favor, and nowadays we use a stool test or a breath test, or diagnose it when we do a scope. We can take biopsies of the stomach lining and diagnose it that way.
Okay, thank you so much. Good information, and if you have those symptoms, make an appointment with you. And if you'd like to talk to either of the doctors, you can find their information on your screen. That's today's On the Beat.